Sexual assault, sexual abuse, and sex trafficking doesn't just occur in other cities or other countries. All of these occur right here in the Northland. So thank goodness also in the Northland are people who are devoted to reducing these problems and helping people recover. Meet two of these devoted people and find out more next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. Our topic tonight may make some of you uncomfortable, but the fact is sexual assault, sexual abuse, and trafficking for sexual exploitation is an issue that needs more attention than it has received. And despite the fact that we are in our third season, this show hasn't talked specifically about getting help for sexual victimization. So tonight we're speaking out. The silence is being broken about this important issue. This show obviously covers a mature theme, so use your best judgment if you have kids who might be watching with you or are in the same room with you as you're watching. And if you have a question or a comment on the topic, of course, we want you to call the numbers on your screen. Right now, locally, you can dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also text us your questions or email them using the number or address listed at the bottom of your screen. And we'll be taking your questions during our entire show, so get to work out there. Let's meet our guests. Sabrina Matheny specializes in the treatment of trauma and is the supervisor of the Trauma Assessment and Family Treatment Program at the Human Development Center. And Sanu Shrestha coordinates the Duluth Trafficking Task Force through the Program for Aid to Victims of Sexual Assault. Thanks to both of you for being here tonight. And I was talking with our guests before the show saying I had no idea that this was going to be Sexual Trafficking Awareness Month when we both booked the program and then when I asked Sanu to come onto the show. And I was so glad to find you. And I want to say that Duluth is so fortunate to have you here working on this very important issue. And let's start, Sanu, by your telling us and educating us about what sex trafficking includes.
Well, the state law defines sex trafficking as receiving, recruiting, obtaining, harboring of an individual to aid in the promotion or to aid in the promotion of prostitution. So that is sex trafficking, and the Duluth Trafficking Task Force recognizes that and has endorsed that and works under that definition. So it's basically the promotion of prostitution. The law has kind of related making that connection of sex trafficking to prostitution really actually just kind of saying that anybody who has anything to do to promote the prostitution of an individual is sex trafficking.
And you know, I think that the history and the way that we've talked about prostitution in the past is as a victimless crime.
Yes, we have.
And I'd like to hear what your comments are about that.
Well, because we've always thought that prostitution was a profession of choice, we never really talked about, or we never really put that much effort into understanding what goes beyond prostitution, what goes with women who are in prostitution, the abuse, the physical abuse, the emotional abuse, the psychological abuse, and the several factors that either push or pull women into prostitution. We've never talked about that. So because we don't know those factors, we've always thought, well, maybe these women just chose prostitution, that it was an easy money-making job for them. So we just thought that, oh, okay, so that's what it is for them, so why care? So why really think about it as a person, or why not think that it's a victimless crime? And so we just, that's what we thought, that it's a victimless crime, but it is not.
And talk a little bit, Sabrina, about your experience in terms of what, in terms of adults, how adults wind up in prostitution and maybe some of the vulnerabilities that lead them there.
Well, I think a lot of times the factors that contribute towards adults who end up in prostitution start as children. And I think a particular focus of sex trafficking in Duluth, or one of the areas that I'm aware of, is looking at the 14, 15, 16, 17-year-olds who get kind of connected with people who are then kind of using them to make money for sex, or they feel like they don't have a choice. And so when you start off as that basis, or they have sex for a place to stay in some cases, or they're using drugs are combined with sexual activity with people, then there's kind of this sometimes this slow, slippery slope into prostitution based on those risk factors that happened earlier in their life, and feeling as if this is the only thing they can do, or this is the way they can get love or attention. And that's a slightly different dynamic than sex trafficking specifically, but certainly there's a lot of overlap in the two.
And history of sexual abuse. Talk a little bit about the role that plays or doesn't play then.
I think a history of sexual abuse, one of the things we know is that when women or children are sexually abused, their rates of being sexually abused in the future skyrocket. And so they are more vulnerable to circumstances that are going to set them up for additional acts of sexual abuse. And if they haven't gotten help or received treatment for being sexually abused, sometimes they don't even recognize that what's happening is abusive. And they get really far into something, and they're sometimes can be so disconnected from others that it perpetuates itself, and they continue kind of the risk and struggle to leave those situations.
Risk factors for people, well, let's back up. Let's not quite talk about risk factors. Who's being trafficked?
Well, anybody can be trafficked. But as just you mentioned, there are risk factors that make some population more vulnerable to being trafficked than other population, whether that be poverty, age, gender, like Sabrina mentioned, history of sexual abuse. These are some of the factors that make an individual be more vulnerable to be trafficked. But anybody can be trafficked, whether it's somebody from a suburban area or somebody from a reservation. Traffickers prey on the vulnerability, of course, but it's likely that anybody can be trafficked. Men, boys, children, women, girls as young as 11, 12, 13, 14. Yep, it goes on and on.
And so one of the things that you mentioned is you can come from a suburban family, you can come from a middle-class family, and I think that there are a lot of people out there that when they hear the phrase sex trafficking, they're not thinking, they're thinking my child is safe, my child has no vulnerabilities because of who I am and where I live, and you're telling us, Sanu, that that is not the case.
That is not the case because what we've seen with globalization and the development with the internet and all of these things, nobody is safe these days. We don't know what our kids are doing next door. And we don't know who they are hanging out with. And there are so many factors that really, the psychological factor, the cultural pressure, so many of these factors are really playing into this, and that have contributed some of our children who we think are really safe to be pushed into trafficking as well, which includes drug abuse as well. Young children getting into drugs and not really finding help when they are just entering into drugs, or just getting into that habit of using drugs, and finding somebody who could potentially come and say, "I'll buy you drugs," and then that just goes from there.
And in fact, that's I think what we see a lot sometimes is that entering into substance abuse, kids don't have money for substance abuse, and it's like, how are you going to pay for this then?
Right. How are you going to pay for it? And that does cross that income gap of, you found someone older who maybe is going to give you drugs the first couple of times in exchange for nothing, but then eventually they start to ask for things and push the envelope a little bit more. And sometimes it's, for teenagers, there can be just the fact of an older person, a 20-year-old, wants to spend time with you when you're 16.
Which
and
is
that makes you feel cool.
Yeah. Right? That makes you
yeah,
feel cool.
And you're getting this attention, and they're nice to you, and they're going to introduce you to their friends. And that alone, in some cases, becomes a risky situation for either sexual victimization or for trafficking.
And I really love the example that you just told, because I think that's another way that the suburban kid can become involved. It's like you don't have to have tons of problems in your family. You don't necessarily have to be a person who's not getting a lot of attention, but that attention from somebody who's older, but not creepy older, just older enough, is enticing then.
It is, also just while you are growing up, when you're adolescent, you really like that kind of attention from a man who looks cool, and you think that he is cool and he's giving you all this attention and buying you all these lovely things as well, that will certainly entice you.
Very nice to you.
Yeah, of course. But then again, the thing that we just need to be careful is, again, there are several risk factors that make certain population and women and children and boys and men be more vulnerable to be pushed or pulled into trafficking.
And what are you seeing in your own practice, Sabrina, or what have you seen even over the years in terms of trafficking and people coming for help for trafficking? I know. I'll tell you what I've seen, and what I've seen is that I've never seen a kid. What I've seen is an adult who 15 years later is telling me the story.
I think will be one of the essential issues that our community will have to face, is that when adolescents and young adults leave trafficking, that's a very complex dynamic. It's not the same as being sexually abused. And I've mostly, similar to you, worked with people who, maybe 5 years later, they're like, oh, that was, we can call it trafficking, but they never would have labeled that. And something has intervened, usually by accident in a lot of cases, to get them away from those situations. But it's a challenging dynamic to begin to treat.
Here's a question from a woman in Duluth. What should people do to watch out for sex trafficking or prevent themselves from being exploited, Sanu?
To answer that question, it's really multi-pronged, and I always like to say, it's just changing our attitude towards prostitution, and always thinking that it's maybe this person is just choosing and ignoring it and undermining their experiences. Let's begin from there. Let's change our attitude towards that, and then also just being kind of vigilant about what's happening in your neighborhood. If a young girl is in a really distressed situation, keeping an eye out for them. And then, like I mentioned in the beginning, you might not notice so much street prostitution happening in Duluth. It's so much hidden now with internet and Backpage and Craigslist earlier. But then still being vigilant and talking, if you have kids, talking to your kids about it also, because we are so kind of afraid of talking about healthy sex habits and sex trafficking, because we just don't want to enter into that realm of conversation. But starting from there is I would suggest a first step, especially for parents. And especially for men, don't buy sex. It's not okay to buy children, women, boys, men. It's just not okay to buy human beings.
So that brings up a really interesting question too, because it's really not just talking about safety to our daughters. It's about talking about these same issues with our sons as well. And so I'm going to ask you, because I know there's some parents saying, like, first of all, what's the age I should begin talking with my kid about sex trafficking or the potential for exploitation?
Right. I think it depends on the developmental age of your child, but I think certainly middle school is a great time to start to bring up the issues of healthy sexuality and of boundaries. And maybe it's not within the context of sexuality, but maybe you're, just having conversations about dating and how old people, how old they think they should be able to date, and what do they see at school, and starting those conversations when kids are younger, so that when they get to be 14 or 15, you've opened the door, and now you can start to talk about, well, what do you think about the 17-year-old dating the 8th grader? What do you think? Let's have the conversation that maybe that's not quite okay. And not quite okay just because it might be against the law if they have sex, but not okay in terms of age difference, developmental difference. looking at issues, when you watch TV, it's hard not to see times when people are coerced into some sort of sexual contact, and using those opportunities to say, you know, what did you think about that? Because it looked like they really weren't interested in going with that person. I think it's also a good idea to teach kids that if they're going, when kids start to go out and go to parties or spend time with friends, to really reviewing, you know, watch out for each other. And if it gets uncomfortable, you know, get out of there, find a friend, like, so that those conversations start in less intense situations.
And parents are already talking with their kids about internet safety and about safety on social media sites. And you all remember Erin was on the show last week talking about that. So that creates sort of a nice little segue then into the conversation as well. And you're talking for our parents also about those refusal skills and skill building and doing that before there's a reason to do that. Sunu, we have a comment here from a woman in Duluth that I think that you will be interested in commenting back on. She has a daughter who was trafficked and doesn't think Duluth is interested in dealing with it.
But we have the trafficking task force now. I guess when any kind of social justice issues come to the forefront, especially in the beginning, everybody has this tendency of kind of avoiding, let's not face this kind of a situation. So maybe that might have been the case with Duluth as well. I'm not from Duluth, but I've only known good things about Duluth, and I'm very proud to be working here in Duluth. But now we have the trafficking task force, and we are working very actively with different service providers and law enforcement and the county prosecutor's office, everybody, and trying to kind of come up with a coordinated response. So we are here. We will try to help as many people as possible, whether they are victims, primary victims, or survivors, or secondary survivors as well. So. And
what are some of the first steps of getting a person out of being trafficked, and what their needs are at that time?
Well, first, it depends on the person, whether that person actually wants to get out of the situation. We always ask people for their safety first. It's very important that they are safe, that they are not in any kind of dangerous relationship with their pimps, or or they call them boyfriends or managers or daddies or whatever they call them. We want to make sure that they are safe. And after that, we really assess their situation and where they are with everything in their life, and we kind of go from there. So far, for us, we are still in the kind of beginning phase of all of this. So when clients come to us, we still work with them, trying to figure out their daily needs, basic needs at this moment. But we hope that one day we can say that we have helped this many clients who could actually transit this kind of lifestyle and are very successful in whatever they're doing today.
Now, in my mind, in my way of thinking, you know, I'm kind of caught between the statistics that say, you know, exposure to traumatic events, only 25% are developing post-traumatic stress disorder, but this is the kind of ongoing trauma, the complex trauma. I'm thinking that my unexpert opinion would be, if you've been in a trafficking situation, likely going to need some mental health care.
Absolutely. And I think specialized mental health care that not only takes into account whatever substance abuse issues that may have been a part of trafficking, that takes into account, I think, some of the intense feelings of guilt and shame for staying in a situation once people are feeling trapped in choices that people made, for the complex nature of sometimes they do view them as boyfriends, sometimes they are getting their basic needs met, such as housing, and it's really difficult to help people understand that that's not an okay way to get your basic needs met.
And often, I'm going to interrupt you a second because of what you said. You know, you said about feeling trapped, and that often if A, they may just be trapped.
True.
But B, feeling trapped makes us trapped as well.
Absolutely. And feeling powerless becomes a really significant risk factor for a lot of depression and ongoing substance use, as I mentioned earlier. And to survive in these situations, people have to use really sophisticated avoidance strategies to not allow themselves to realize how bad it is and to get through every day. And those same strategies that help them get through and are protective become not helpful in healing the emotional wounds and the mental health issues once they leave the situation.
And I think that Sabrina just sort of touched on what you had mentioned of when you're talking to people who are being trafficked, and you had mentioned this notion when they're ready to get out of the trafficking, and the part that Sabrina said about really burying the feelings that are coming with it in order to even have some ambivalence about wanting to get out of that, when most of us sit here saying, like, why would you not want to get out of that?
Yeah, especially what we've seen with our clients is that they start really young. So when they start at 12, 13, 14, 15, and they've been in that kind of lifestyle for however many years that is, they don't have any kind of social skills that they usually needed to develop while growing up. We have clients who are 24, 25, but are still 15 at heart. So we work with that kind of population, so we have to be really careful as to what their needs are, not really kind of looking at their external exteriority and say, well, this person is 25 and should know better. Right. They really are not.
Now, Sabrina, you know something, a little something about the sexual perpetrators as well, and which I'm sort of putting the traffickers in that category, wrongly or rightly. But a man from Duluth is asking, who or what group is the major exploiter of sex trafficking? Who's abusing and using, and who's abusing?
Well, I think it really can be anyone. Statistically, it tends to be men, and it tends to be men who come from a background of domestic violence or physical abuse more so. So it's not necessarily men who have a history of sexual violence or even exposure to sexual violence, but that exposure to domestic violence and the attitude of how you treat women is a more significant risk factor.
And we're getting short on time already. I can't believe this. So I'm going to go right to a question then. Sanu, a woman from Superior asks, she's asking two questions here. I love her last question, but I'm going to ask you, the first question is excellent too. Is there adequate housing for support for people who are being trafficked or getting out of trafficking?
There is none. Especially in Duluth, we don't have any housing facilities that can house trafficking victims. But we hope that because of this awareness, there's more. There are people and foundations and governments who can give us more grant, and that we can satisfy that housing needs.
And I just heard a call for money out there, viewers, which is what they're saying is that if we want to address this problem adequately, we're going to need financial resources to do that.
Of course.
And here's the other question: where can I volunteer on this cause?
Oh wow, wonderful! That's a wonderful question, and thank you very much. Well, I work for PAVSA, Program for Aid to Victims of Sexual Assault. We have a lot of different volunteering opportunities. We have advocacy training coming up. So if you'd like, please give us a call or go to our website and sign up for our volunteering programs.
What would you say, Sabrina, to parents who are maybe, because one of the things I've heard a lot on NPR are parents who are still looking for kids who maybe are runaways, and what would you say to those parents?
Well, primarily, I would say get support for yourself, that you are in a really difficult situation, that there will be no fast answers, and getting the emotional support and being able to take care of yourself so that you are in a really good and solid place, when or if your child is found, is, I think, the key. And talking to people, not staying kind of stuck in shame, but really reaching out to, whether it's mental health professionals, people at PAVSA.
Because what you mentioned about shame is that parents often feeling that I might have been part of the problem of why my child ran away.
Absolutely.
And not wanting that shame getting in the way of help seeking then.
Right. That for parents, a lot of times it's easier to blame themselves, and that at least gives people an answer, but stands in the way of them getting help. And so we would, it's okay that no one's going to blame you and no one's going to think poorly of you, and people are really going to want to support you. And if you need to find those people, and they're there.
Treatment programs for people who've been sexually assaulted, sexually abused, and sex trafficked, effective, helpful?
Very effective and very helpful. I think you need to do some, there needs to be some assessment in terms of what's the best treatment option, depending on all the multiple variables, but certainly helpful. There are group formats, there's advocacy group through PAVSA, there's trauma-focused therapy available through many different providers in town.
And trauma-focused therapy, not just for individuals, but for families then as well, because that's one of the programs that you head up.
Absolutely, we run trauma-focused cognitive behavioral therapy, and the key idea is that the therapist is going to leave your life. We don't want to be part of your life forever, but we really want this to become, whatever the traumatic event is, the sexual abuse, the sex trafficking, to become something that you and your family can dialogue about, because you're going to be together, and the fact that everyone's willing to come together means that people are going to be supportive, and we want to help with that process.
We're out of time. Thanks to both of you for being here
you.
this evening. I really appreciate this. What an important topic, and I just feel that we were so fortunate to have these truly experts in this area. And so what did we learn today? In fact, what we learned is that Duluth is interested in sex trafficking, and more specifically in doing something about the sex trafficking problem to help victims of sex trafficking. We also learned that this is going to take some financial resources, and that it takes a village. We are part of the village, and that means we're all going to need to share in that responsibility. And of course, you heard Sabrina say that there's help available, and in this community there's excellent help available for trauma survivors of all ages, so that you can get beyond the trauma experiences that you've had and lead a meaningful life that isn't overshadowed by a trauma experience. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I answer more of your questions. You can also email us your questions about next week's show, when we'll talk about living with chronic pain. That does not sound like too much fun, but we're going to talk about the good side. There is an upside to this, which is how to lead a fulfilling life with chronic pain. Even so, I'm Dr. Carolyn Phelps. Thanks for watching, and good night.